Welcome back. Continuing our road safety coverage, we want to touch now on the medical issue and the public health side of things.
9 News medical expert Dr. Payal Kohli joins us now, and we often hear trauma experts talk about the golden hour. What exactly does that mean?
Very important. That first hour after a car accident, or any kind of accident for that matter, you really have to assess whether or not there's any critical or life-threatening injuries. So let's talk about the things that you would really look for. Brain bleed. Breaking your spinal cord or injuring your neck, problems with your airway or trouble breathing, or some kind of internal hemorrhage. Now, somebody could look okay, and they could still be having an internal catastrophe, and that's really why it's important to use those first 60 minutes to try to recognize what the signs and symptoms of that may be.
So, for the untrained eye, that can be difficult.
Yes.
I've gone through courses, several of them over the years, and it's always sort of perplexing when you see someone lying there, how to sort of triage when you're not a medical professional.
So the first thing is as much information as you can get about the accident is helpful. What kind of impact was it? Was it side? Was it front? Did the airbags deploy? Were they wearing the seatbelt? If they fell off a ladder, how high was the ladder? Did they hit their head? Did they lose consciousness? Are they complaining of anything? And then you go through what's called the ABCs of assessment. This is what we do in the emergency room or the hospital. Airway. So the best way to assess somebody's airway, if they're talking, they're moving air, they're awake, they're protecting their airway. Breathing. Do you hear any kind of wheezing, choking? Do any ribs look like they're fractured? Does it look like their chest is expanding and moving air bilaterally? And then circulation. So you put your finger on their pulse, and everyone, I want you to feel both of your pulses to know where they are. This is where you would feel, and you can feel your heartbeat there. Yeah.
Is this better than your neck?
Neck is better in an emergency, but sometimes if you can't quite find the neck, it's a little easier.
Is that because your neck is closer to your heart?
It is. Okay. And so you start to drop this pulse first, and then after that you would drop the neck one. So you should know where the one is on the neck too. But if this starts to become thready or weak, they could be hemorrhaging inside, and it's really up to you to recognize that. So that's C for circulation. D for disability. Try to see if there's anything neurological going on. And I start by saying, do you know where you are? What just happened? Who's your child? You know, what's your husband's name? Just questions that they should know the answer to. And if they can't answer them readily, then that's a problem. And then E for exposure. Try to look for the seatbelt sign. If they have a bruise across their chest or their abdomen, yes, the seatbelt worked, but it could be that you lacerated or injured an internal organ.
Wow, those are really good tips to keep in mind. Also, I want to ask you specifically, because I know a lot of people think we're all guilty of it to some degree. That's texting and driving, looking down at your phone at some point, you know, before the red light turns to green. But you say this isn't just like a bad habit, that this is more intense than that.
This is a public health emergency, guys. We're in the middle of a public health epidemic. Because if you think about what we do when we're driving, it's one of the most difficult things. Visual spatial, so you're looking at where the other cars are. You're doing a risk assessment. You're making decisions, and then you're doing motor motions to implement those decisions. So it's a really complex task for our brain. And when you're looking away, you don't just take your eyes off the road, you take your mind off the road. So it's really that cognitive distraction that's really very deadly. So I like to tell people, and the World Health Organization does as well, if you're using a hands-free phone, that's not okay. Because then your mind is still on your phone call. It's not paying attention to what's on the road. So really no mobile devices when you're driving. It requires all of our brain power to do it. And as hard as it is, we really have to do it for the right reasons, because people end up dying every single year or get paralyzed because somebody was texting and driving.
Those are all good things to keep in mind for the average person who doesn't have medical training. All right, Dr. Kohli, thank you.